Hi, everyone. Dr. Nemechek here. I want to talk about migraine headaches and why you have other neurological problems with them. All right. So, there's all sorts of work going on for migraines, and a lot of it, unfortunately, is focused on how can we develop a drug that can somehow fix these symptoms a little bit and make us billions of dollars, from the pharmaceutical company's perspective. And it's never really discussed correctly. So, and the Dutch are doing a lot of this work in terms of autonomic dysfunction. And basically, if your blood work and your chemistries are fine, you don't have high blood pressure, you aren't overtreated with blood pressure, lowering drugs, headaches, almost all headaches, with the exception of sinus headaches, almost all headaches are from low blood pressure. And what happens is when you have suboptimal blood pressure, so oxygen is carried in red blood cells. You got to fill them up in the lungs, and you got to push them into the head at the right pressure, and you need the pressure for the oxygen to jump from the red blood cell into your neurons and the red blood cell into the muscle cells on the outside of the skull. Okay, so you're going to have blood pressure problems on the inside of the skull. That's going to give you some neurological things. You're going to have low blood pressure in the muscles. All right, this basically is migraine headaches, tension headaches, cluster headaches. I don't care what you want to call them. Okay, with the exception of sinus headaches for the most part. And there's some other rare things like hydrocephalus and stuff, but you're going to have a whole bunch of other symptoms, and the neurologist is going to pick up on that. Okay, so people say, well, how come nobody's talking about this? Well, they just don't think about it right. They don't actually. There's a great deal of evidence about this, but the problem is if the autonomic nervous system is broken, doctors don't know how to fix it. Okay, and so they're using drugs to just fix your symptoms without trying to fix the problem. Now, simple test. Migraines or other recurrent bad headaches, okay? What do you do when you get them? Well, I go lay down flat. Okay, when you lay down flat, you get rid of gravity. You're now able to get more pressure into your brain and the scalp muscle. Because you have more pressure, you get more oxygen into the tissue, your symptoms get better. Okay? And so that's a little proof right there. The other thing is, and I've talked about this in another post about salt. If you eat salty foods or you keep moving your muscles, that'll generate blood pressure. Salty foods boost blood pressure. Nicotine boosts blood pressure. People will do a lot of things. As long as they're active, they don't get headaches. It's afterwards, after they calm down, the pressure drops. Is a common thing. They'll get them in the premenstrual cycle or in the menstrual cycle. When progesterone drops, blood pressure in your brain drops. So that can be a trigger for your headaches as well. And so you'll get this drop in pressure. The scalp, neck muscles will hurt, okay? And it can be brutally painful, all right? This is like when you have a narrowed artery in your heart. It's called angina. And it's so painful in the heart muscle that people describe it like an elephant standing on them, okay? Okay? This is what muscle does when it doesn't get oxygen. It's brutally painful. And so you're getting it on your head, okay? And it can be one side or another, just depending on anatomy and how the blood is not really being pressurized equally at lower pressures. And this is why people have other neurological symptoms, like, I see lights, or sometimes I lose my vision. That's the low pressure in the brain, okay? Some people have trouble talking. I have a patient who would get recurrent, almost like a full stroke on his left side when he would get his migraines, but he was so frustrated because nobody could figure out what was wrong so here's his head, he can't get pressure up there, so he's got the pain, the brain's not working right in the part where to move his left side of his body. So what do? They put him in an ambulance and a gurney, usually with an IV, so he's getting fluids and he's flat, and by the time he gets to the hospital, whatever, 10, 15 minutes later, the symptoms all go away. And you can move. And they're like, well, everything's fine. And it happened over and over and over again. Okay? So migraines are just, with aura and these other kind of things, they're just low blood pressure to the scalp muscle that gives you your pain, and they're low blood pressure to areas of the brain, which gives you these funny kind of neurological symptoms that go along with it. So, and now, how do you fix this? You don't directly try to fix the brain. What you have to do is lower inflammation, because we've learned in the last 6-10 years, the brain has these very robust mechanisms to repair itself. You just got to lower inflammation and let the brain fix it. And our protocol is designed just to do that. High dose DHA, high dose olive oil, balancing the gut with rifaximin, or the brand name Xifaxan, some vagus nerve stimulation, and typically people with bad migraines. So I'll see people, we start them on the protocol, I'll see them in 3 to 4 months. People who are having migraines like almost every day will very quickly be down to like once a week. Give them a couple more months, it's like once every many weeks. It very quickly starts improving, okay? So, but you got to make sure, you got to go to your primary doc and make sure your labs are okay, you aren't anemic, you aren't overtreated on blood pressure medicines, you don't have florid heart failure. I mean, if you generally feel well, then you don't have any of those, but it's always wise to have that check. So anyhow, hope that's helpful for y'all. Everybody have a great day.